Morning everybody. This topic we are discussing about the basic life support. Actually, it's a workshop, but in this COVID situation, we can never go for a workshop. So we will teach about the basic life support things. So remaining learning outcomes in this how will you uh, treat a medical emergency that facing in the dental office, and what are the signs and symptoms showing in the medical emergency, and how will you treat medical emergency. So what do you mean by life support? It refers to the care of healthcare providers and public safety professionals provide to the patient that who are experiencing respiratory arrest, cardiac arrest, or the airway obstructions. So DLS includes the psychomotor skills for the perform high quality cardiopulmonary rescue, that's called CPR, using with automated external defibrillation AED and relieving the and obstructed airway from the patients in all ages. So you want to know about the BLS, CPR, and basic information on the medical emergency management training and practice, and how to contact the EMS, everything. So how can we prevent the medical emergency? First is an accurate and a complete medical history of the patient. It is very important. We will counter check if the patient having any problem regarding the cardiac, respiratory, or renal, anything, any medical emergency, bleeding disorders, any problem, we have to find it out. And treatment modification, manage stress and anxiety. It is very important. If the most of the patients have stress will be there, so stress is according to the American Society of Anesthesia, they are classified into as one means normal healthy patients without any systemic disease. ASA2 is patient with a mild systemic disease. ASA3 is patient with a severe systemic disease that limits the activity but is not incapacitating. ASA4 with the inhibiting systemic disease that means a constant threat of the life. ASA5 is morbid and patient it's better to surrender more than 24 hours. ASAE, that is an emergency operation. If the patient having a severe, maybe any traumatic or any cardiac problem, suddenly we want to operate, no? Then we can emergency. So, what's the pathophysiology for the CPR? First, we want to maintain the airway, and first, we want to set the circulation also. There will be oxidation and the glucose. Most of the 65% of the glucose and 20% of the consumed by the brain. So cerebral blood flow is being be 50 per 70 ml per minute at any time. The brain has 10 ml of the oxygen. Sufficient maintenance functions for about 10 seconds. So inadequate cerebral blood flow and the reduced cerebral metabolism. So if the patient is unconscious, how will you treat? First, we will recognize the problem and assess to respond to the sensory stimuli, as shake the patient's uh, pain and loss of protective reflex and immunity to maintain the patient airway. So first you check about there will be any obstruction in the airway, and we'll remove this and ask to maintain the airway and terminate all the procedure and call for the help. So first one, for the unresponsiveness, first ask the patient, are you alright? You check the patient and ask, and don't ask like slowly. You call vigorously and ask, are you alright? Like that, and call for the help. Call the medical emergency team. Then position of the patient, that is very important. Supine with the thorax and the brain the same level, feet from 10 to 15 degrees slightly elevated. That means you are never bend the legs completely. Raise your feet, then only the cerebral flow back to the brain. And assess and open the airway. And the open airway, the tongue will fall back and obstruct the airway. So upper airway obstruction by the tongue and the epiglottis. So if there will be uh, trauma to the neck or region, don't bend the neck. That will leads to damage. So head tilt and chin, that is the most of it. That means left hand you're placing on the submental area, and chin lift and head tilt, that is you are depress the forehead to the down. If the patient having trauma, then definitely jaw thrust. That means you're placing the fingers on the posterior part of the mandible and lift. So the patient airway, the obstruction will be free. You can see in the diagrammatic how they are doing head tilt and chin lift, placing on the finger on the chin region and forehead. Assess the airway pendency and the breathing. Check for the breathing. Look for the chest movement. Listen for the air escaping during the and feel the flow of the, if the flow will be normal, okay, the patient breathing is normal. And record the position under responsible breathing and the circulation. Must check all these things uh, in a immediate manner. If there will be any foreign body, no, then go ahead and suction the throat or sweep with the finger to remove the foreign body, and for the to prevent the aspirate, otherwise patient will aspirate the foreign body. Artificial ventilation, then expired air ventilation, atmospheric air ventilation, enriched oxygen. Ventilation might be through using with the mask. Atmospheric through the abu bag will do. Enriched will be using with the oxygen cylinder. Breathing, the positive pressure ventilation, that will not dilute the positive pressure ventilation, that we using the amber bag, we using the mask, that's a leak proof seal. Leak proof seal, how they will do, perfect C and the index and thumb finger they put on the mask, that on the C, and the three finger that rest on the mandible, that on the ring finger middle, and the little finger that support on the mandible, that is called, you can see in the second diagram how they on the right hand, they cover the mask with the thumb and the index finger and the three finger that will support the mandible, that's the lead C. And squeeze ambivax slowly, listen 2 seconds, observe the chest rise and delivers to initial breath. And select when no, select when the pain is usually called triggered pressure or a gentle pressure compress the esophagus behind the trachea. So air tends to stomach the tends to the goes back to the, mostly the cartilage will compress the esophagus. So what will now? So when you administering the back, air will be directly goes to the stomach when you're using the ambu bag. So and the air will goes to the stomach and it will compress the stomach, and sometimes it will deagitate and use open. So if you compress that record now, so it will goes to directly to the esophagus. So when you administering the air, no, it directly goes to the trachea. Next one is the circulation check. Locate the trachea and check the carotid pulse. That is like between the trachea and the sternocleidomastoid. Uh, the patient head and check. The patient having neck to injury, don't do it like that. There will be massive injury will happen. So generally feel the carotid pulse. So definitely it will never take more than more than 10 seconds. That is very important. So that means look at the trachea is V-shaped group here and check your finger on that, and don't tilt mostly the patient's head, because most of the emergency cases will be injury to the neck, so they don't do it. So always do in the straight position and look at the pulse. If there will be no circulation, then definitely go for the immediate treatment. So this is the algorithm of management. How will do. First we study airway, obstruction, breathing, and the pulse, everything. So how will you do the CPR? Place the heel of the one hand on the breastbone or just below the nipple, and place the heel of your other hand to top of the first hand, position of the body directly over the hands. Give 30 compressions, that's very important, and this should be done fast and hard. Press down 2 inches into the chest each time. Let the chest pulse completely. Count 30 compressions, 1 2 3, like 230. Then you give 2 mouth press. Then again do the same thing, chest compression, like. So never bend your shoulder. The operator will stand side of the patient and do using with your shoulder. So mostly these things will do it on the floor, not do it on the mattress. So otherwise what happen that when you compress the foam also will compress, so there is no action. So we'll do it on the floor. We'll do 30 compressions and 2 more. So this is the ratio for the patient. You can see in the diagram how they are doing is always in the straight and do the 30 compressions and 2 mouth breaths. So always you see and never bend the shoulder, or your elbow always should be straight. This is the algorithm showing for the infant how they will do. Now this is the chest compression. So previously there's service guidelines and no previously ABC. Now it's from circulation, airway and breathing. So first you will compress. That means we will give the circulation, then we will give airway, then we will give for the breathing. These are the airway. We want to maintain the airway. First, on the left side, on the top, that is called the pedals airway or pharyngeal airway, and second one is the nasopharyngeal airway. One we using through the organ and one is through the nose. So already this is seen on the. It is in our emergency trolley. I can show it. This is the ambu bag and the different types of the mask are called the EC technique. I already mentioned how we using. That means how will you put the E and C, the thumb and the index finger showing on the mask, and supporting the mandible using the ring, middle, and the little finger, and the and we want to give the survey manual using the support the someone will assess the support the cardiac to put for the esophagus. These are the various type of oxygen masks. There are nasal one, simple mask, ventral mask, and a rebreathing mask. There are lot of masks so we can to maintain the airway. Only this is only for the your information. This is the endotracheal intervention. So this is for the to administering the tube. No, endotracheal tube. There are different sizes will be there. So this is commonly used by the anesthesiologist where they intubate the patient. You can see the left side that is called the laryngoscope. This is the tongue blade, and you can see the larynx. So we can see where the tube can goes to the esophagus or the larynx. So you can see there's a tongue. It's a blade, so it will depress the tongue, and we can see the intubate the patient using the uh, tube, endotracheal tube. So we can pass it through the trachea. So you can see in the diagram how they're using the laryngoscope, stand behind the patient and depress the tongue, and the right hand we are using the endotracheal tube and pass the vocal cord and pass it. Someone will support the cartilage, so it will directly goes to the trachea. The diagrammatic presentation how to show the compression, and next one is the Heimlich maneuver. Okay, where we'll do the Heimlich maneuver if the patient having the patient airway obstruction or eating the food stuck on the throat, and patient gagging and coughing on starts choking everything. So there's been a warning before a patient gets object caught on their the throat and starts choking. For the area to the techniques to deal with the emergency. If the patient is choking, how we'll do take out the foreign body. So our body will respond for the choking to remove the foreign obstruction. So choking is the mechanism to flow the air from the environment into the lungs. Choking promotes the breathing and can be partial or be complete. Prolonged or complete choking through the anesthesia, which leads to anarchy and potentially failure. What are the causes of choking? Eating, the more especially eating and laughing at the same time, eating too fast and failing to chew food well enough. Alcohol or drug consumption in a small amount of effective awareness. Trauma to the head and face, bleeding and cause also choking. Small objects swallowed by children, especially in the toys. What's the lack of oxygen without the oxygen in the brain and begins to take within the 4 to 6 minutes. By learning the Heimlich maneuver with a simple saving technique, you may literally save the life of the choking victim. So, first, what we'll do if the patient is choking, we will do first do the Heimlich matter? No. First, you encourage the patient to cough. If the patient can cough, that is very good. If the patient can never cough, no, then you give a back slaps. You slap on the patient back slaps, so somebody to come out early, and also encourage the patient on the meantime. If the patient can never cough, no, then we'll go for the under that is for Heimlich maneuver. And if the patient we can feel the we can see in the organ, we can use the finger sweeping and direct visual removal, and the patient can never breathe anything, and we go for the CPR also. So, heavily manual is the most effective way to remove the something stuck in the adult or adult child's throat. Lift the diaphragm and forces enough air from the lungs to remove the obstruction. So when do I use the Heimlich maneuver? The person is grabbing the throat with the hand. That's the universal. The patient is placing the hand on the throat, and you notice they are gagging. You hear a weak of ineffective of noisy breathing and or high pitched sound. Patient starting to look blue. Means the patient is having airway obstructing. What to do? Stand behind the patient, choking patient, and wrap your arm around his or her waist. Place the thumb side of the fist against the middle of the person's abdomen, just below the navel and well below the ribs. Press your fist into the patient's abdomen with quick upward thrust. Repeat the abdomen thrust until the object is cuff up. That means patient stand behind the patient, wrap your arm. After that, just above the navel and below the ribs, and put upward and backward. Then the object will come out. We will do it very fast. Then only the object will come out. If you are doing like that, no, there is a gush of air that will uh, remove the object through oral cavity. Diagrammatic photo how we will place for slightly bend the patient and making a base and placing over the navel and upward backward. What will do to compress the patient's navel or abdomen. So rescue the places the hand in the center of the chest to compress rather than the abdomen. So we are placing compress on just the compress rather than the abdomen. So how will you do if the patient self-rescue? How will you place fish above the navel and while grasping first on the other hand and leaning over the chair or countertop, drive into them first, and then yourself with the upper thrust. So then offset the object we can come out. So how will you do it in infants? Infants less than 3 years are more prone than adults. So determine if the infant is can cry or cough. If infant is choking and cannot cough, cry or breathe, then follow the Heimlich maneuver as follows. First one, place the infant's stomach down across your forearm and give 5 quick or forceful blows on the infant's back with heel or your hand. That means you can see on the diagram how you place the baby and back slaps on the patient's back slowly with your heel. Then place 2 fingers on the midline of the infant and 5 quick pressure. And sometimes you can just rest on pressure that will create the thoracic pressure, then it will create the foreign object. Is the look in the mouth to check if you can see the object, to move the object. If you can see with the finger, don't use your entire hand to the oral cavity. Repeat these steps 2 and 3 above until the object is expelled or infant become unconscious. If the infants become unresponsive and call for the medical. The following expression of the object keep the victim still and get medical help. Complication can rise from the or from the measures that were taken. So this is the end of your BLS class. We can do it only on the mannequin, but augmented situation we can never do. Uh, so this is the only way we can teach you. Thank you.